Hi, welcome to segment 2. We're going to be moving on to ventilator graphic analysis. Again, I'd like to reiterate that this program is geared towards respiratory therapists who are beginning to work in the intensive care settings with mechanical vents. Obviously, not all ventilators have graphics. It's not a necessity, but they can be used as an excellent tool for recognizing certain issues with mechanical ventilation. So graphics are a great tool, but learning to analyze them can be tedious and kind of boring. If you're a respiratory therapist, you've already been through it once. So for the purpose of this segment, much like with the last video, we're going to focus on troubleshooting. I'm going to take you through some of the more common problems and show you how to fix those. The first thing we're going to look at is how to use graphics to determine whether or not the flow is set appropriately for your patient. In simple terms, flow can be defined as how fast the vent delivers a breath to a patient. In the mode most frequently used in our hospital, assist control, flow is also used to determine the patient's IE ratio. We know that with normal breathing, an IE ratio is typically 1:2. So that serves as a good reference point, but we're going to set our flow according to our patient's inspiratory demand. It's likely that the patient's inspiratory demand is going to change throughout the course of mechanical ventilation, so it's important to know how to adjust the flow to meet that with each vent check. Alrighty, so this screenshot is pretty typical of something you'd see in one of our intensive care settings. There's two scalars here. The first one is the pressure by time, and the second is the flow by time. And to determine if your flow is set correctly, you're actually going to look right up here at the top at the pressure by time scalar. You can see these nice square waveforms. That's what we're going for. So we'll say that with this nice square waveform we have right here, that our flow is currently set at 50. Let's say that we didn't notice the graphics when we first walked into the room and we decided to take our flow up to 60. What you're going to see are these little spikes at the beginning of your pressure platforms. Now these little spikes here mean that your flow is set too high. You drop your flow back down and you will see those disappear. Now let's say you had the opposite problem. Say for example that you go into a room and your patient's peak flow is set at 30. Your graphics look like this. Instead of our ideal square waveform, or the spike that we saw when the peak flow was set too high, what we have now is this lag. The waveform kind of drags. This lag just means your peak flow is set too low to meet your patient's inspiratory demand. Increase it to increase patient comfort and get your square waveform. That gives you some information on how to use graphics to appropriately adjust your peak flow. The same can also be used for rise time. Now, rise time is similar to peak flow, except for it applies only to spontaneous breaths, but the same concepts apply. Alright, here we are again on the pressure by time scalar. This time you can see two different kinds of breaths. These are your spontaneous breaths, and this is your mandatory breath. So when you adjust your peak flow, you're adjusting these breaths, and when you adjust your rise time, you're adjusting these breaths. And ideally, you want square waveforms on both of these. As you can see, we have a lag here in our spontaneous breaths. So in order to fix that, you're going to want to increase your rise time down here. The opposite of that is the issue with the spikes. If you see spikes, your rise time is too high, you need to turn it down. So regardless of the breath type on a pressure by time scalar, a lag means your breath is being delivered too slowly and a spike means it's going too fast. Just remember to adjust the appropriate setting for each breath type. The flow for mandatory and the rise time for spontaneous. So that covers how you can use ventilator graphics to adjust some of your settings so they're most appropriate for your patient. Now let's look at some troubleshooting aspects of graphics. Now we'll look at how to use graphics to identify leaks, water in the tubing, as well as air trapping or auto PEEP. We'll go back to our 840 snapshot here. So to determine the presence of leaks, you're actually going to take a look at the flow by time scalar this time. This is actually a really good image of a leak. You can see the patient's inhalation and exhalation. Again, this is the flow, and the flow continues even though the breath is done. This highlighted continuation is the visual representation of the leak. That flow is continuing to go even though the breath is done. Obviously, you want to go through your regular troubleshooting techniques to make sure there are no unwanted leaks anywhere in the ventilator circuit. Now that we've learned how to use ventilator graphics to determine if there's a leak, we'll take a look at the opposite problem, air trapping, or auto PEEP. Staying with our flow by time scaler here, you can see on this breath that the flow never returns to baseline before the next breath is initiated. Remember, this line here represents the patient's exhalation flow. So the patient wasn't done breathing out before this breath started. That's an example of air trapping or auto PEEP. If you have a patient who is doing this in volume control, a small amount of air is staying in their chest with every breath. This can lead to unnecessarily high pressures, volume trauma, as well as patient ventilator asynchrony. You can fix this by adjusting your peak flow and manipulating your IE ratio to give your patient a longer time to exhale. By increasing the peak flow, or how fast the breath is delivered, you shorten the inspiratory phase and lengthen the expiratory phase of each breath. Again, with auto PEEPing, you want to increase peak flow to alleviate this issue. Lastly, we're going to take a look at how to identify water in the tubing with your ventilator graphics. Our facility now primarily uses HMEs, or heat and moisture exchangers. But according to guidelines.gov, the use of HMEs is contraindicated in the following instances, and the use of a heated wire is suggested. HMEs are contraindicated for patients ventilated with low tidal volumes or patients with ARDS, as well as those with thick copious secretions or low body temperatures. For that reason, it's important to learn how to use heated wire circuits and how to maintenance them. One problem with heated wire circuits is water in the tubing. So when you have water in the tubing, you're going to see some of this wavy artifact on the flow by time scaler. If you look at it closely, you can tell it's real jagged there. Obviously, that can be corrected by emptying the water in the tubing and adjusting the temperature on your heated wire circuit. So that concludes segment 2 on ventilator graphics. You can go ahead and take the test on the link below.